When athletes present in either chronic pain or persistent pain, or they've got new sort of musculoskeletal pain, or their status post-surgery or injury, one of the things we try to work our heads around is simplifying the complexity in that person's life. So to this end, I want to take a second and talk about the importance of sleep. So one of the reasons, of course, everyone knows we need to sleep and we need to get X amount of sleep for performance, is that we just want to appreciate that pain and persistent pain can absolutely be affected by how much sleep I'm getting. In fact, if I'm trying to untangle body composition, persistent pain, injury, nagging sort of musculoskeletal problems, I need to know what's what. And one of the things I've stopped taking for granted is my athletes or patients' sort of subjective reports about sleep. How do you sleep? Great. All right, well, let's cross that off the list. Well, it turns out that's probably not as an effective way to make sure we're actually understanding what we're understanding, getting what we're getting. Because there's a lot of times as we sort of take the systems approach to untangling some of these things, we say, well, is this a sliding surface problem? Is this, joint capsule restriction? Do we have muscle dynamic issues? Is this a movement quality related problem that we can change or change some aspect? But the big one is that environmental health piece. And unfortunately, the physician isn't set up to talk about this. The physical therapist isn't set up to talk about this. The chiro usually isn't set up to talk about this. So where are we going to talk about? Where are we going to talk about managing some of these aspects of lifestyle that we know are so important, especially in creating a durable, resilient human being? And it turns out that when we start to correct for some of these base behaviors, we start to see tolerance come back up in the system. We start to see a little bit more resilience in the system. Pain sensitivity drops. We start to auto-regulate hormone function and even protein synthesis, or even sort of our abilities to engage differently with the world, okay? So when we are talking about this, and someone in your life has got chronic pain or persistent pain or status post-injury surgery, do not take their sleep for granted. In fact, our family uses the Whoop. That's how Juliet loves to track sleep in our house, and because I go to bed when Juliet goes to bed, I often see my sleep density and sleep scores. But if you want to use an Oura Ring, you want to use some other kind of sleep tracking device, what I'm suggesting is you don't necessarily have to throw some money on it, but it really helps to know what you know. To make sure that when we are communicating around environmental control, lifestyle control, do you feel safe? Do you feel stressed? Are you eating food? Are you drinking water? Are you decongesting? That we get the sleep piece at least dialed or sort of crossed off the list. Now, let's establish some benchmarks. Now, recently I saw a good physician put up and say, do we really need 8 hours of sleep? That was what kind of his preposition. And I want to just say that, look, the human being is insanely tolerant, but having a benchmark or a guideline is really useful. And so here is the one that we have adopted. And this is from the sleep doc, Kirk Parsley, who I used to get to work with a long time ago when he was active Naval Special Warfare working with teams. These are the sort of his goalposts. And what I want you to appreciate is that our minimum is trying to get 7 hours. So I want you to think, hey, if I'm getting 7 hours of sleep, then that's my minimum threshold for sort of acceptableness, right? And what I want you to understand about this is that you may need to be in bed for an additional hour in order to get that 7 hours of sleep. And especially if we're seeing people managing pain, managing persistent pain, chronic pain, injury, surgery, they're gonna not be sleeping very well. Why? Because their brain is trying to keep them moving, tissues are getting congested, or they're starting to ache, or there's not any input, and that desire to move is actually a protective mechanism so that you can get those tissues decongest or move or off that painful joint surface, right? So part of the mechanism means that, hey, I really need to make sure that I'm actually getting enough sleep. And going to bed at 11 and getting up at 6 is not 7 hours of sleep. Plus the sort of disruption in there, you could end up being in the 5s. And we really are going to see delayed healing, not optimal adaptation to exercise, and certainly going to have a brain that's more sensitive to perceiving what's going on downstream as threatening. So our goal then is to try to say 8 hours is our minimum. So again, why are we having this conversation? I know you're a special, unique snowflake who only needs X amount of sleep, but the rest of us, the rest of physiology, the rest of human history, turns out this is a pretty great number, which means you may need to be in bed for 9 hours in order to get 8 hours. Now let's talk about that a little bit, and let's talk about some cues in there that are more actionable than just telling people to go to sleep. One of the first ones we love, and we're going to borrow this from Kirk Parsley again, is set an alarm. Set alarm for 1 hour before bed. And the idea here is what we want to do is begin a sleep routine, especially when people have disordered sleep or their sleep has been monkeyed up because they've been in stress, because they've had surgery, because they've been persistent pain, chronic pain. So what we're really trying to do here is set this pre-contact cue system for ourselves, just like we would for our kids. So if you know that you have a child, now we're starting to get ready for bed. We take a bath, and then we read, and then we go to bed. The number of steps help our brains to know what comes next. And humans are, especially adult humans, are pretty terrible at this. Like we're on the Facebook, on the phone, et cetera, et cetera. So the idea here is that hour before we go to bed, the alarm goes off, and we're like, okay, now I need to start preparing myself. So one of the things we love is, can we do 10 to 20 minutes of soft tissue in that hour? And the reason we love this soft tissue work, right? Doesn't matter where you want to work, non-threatening, work on a soft, it's just like getting a massage, which can trick our brains into a little bit more relaxation. And the research is pretty clear that this soft tissue work can help decrease sleep latency, so I can fall asleep faster and set myself up to have a little bit better sleep. So get some soft tissue work done, but we're working sort of backwards. We want to get off electronics. Everyone knows that, electronics. And the idea here is to start to get out of that sort of dopamine, blue light, crack cycle and start to prepare ourselves for sleepiness. So getting in a dimmer room, wearing the blue glasses, whatever it means. But hey, maybe this is a great time to remind myself, hey, I need to start to attenuate that off. Get the phone out of your room. Get the TV out of your room. Matters less if you're super non-stressed, killing it. Matters more if you are into any of these things that we're talking about. But now we get to sort of work into the day. And here's a couple great pointers. One, that makes a big difference. If you're having a problem with this, I want you to get 12 to 15,000 steps. And the reason we put that in, and that can be done at 500 steps a time, walk around your room a little bit, the shorthand is I want you to get more non-exercise activity so you can accumulate enough fatigue to actually go to sleep. What we see when people in pain or injury is they may not be getting their regular amounts of activity where they are accumulating enough exercise fatigue so they want a trigger to go to sleep. So what we have is a well-rested body, even though it's under this pain stress, that hasn't accumulated enough fatigue to go to sleep. So anytime we have a sleep disturbance, we start thinking, hey, I need to up my steps. And if I just think to myself, I'm gonna get more steps than I did yesterday, that's great. That's an easy way to start to get that movement fatigue in. And an exercise session or rehab does not count. That's a separate training thing. We want to cut off caffeine, cut the coffee between 12 and 4 o'clock. And the reason is that some of us, fast caffeine metabolizers, we can go to 4 p.m., but what we know is that this caffeine stays around in your system for a long time, and it's going to disrupt your ability to fall asleep, feel sleepy, etc. And when we're fatigued, usually somewhere between 12 and 4, we want a little caffeine bump to get through the evening. And if we can avoid that, we can really actually start to feel sleepy. So if you start to feel sleepy in the evening, do not pass out on the couch, go right to bed. Use that cue to feel sleepy and to feel fatigued, and we're masking that oftentimes with caffeine. So getting off of the caffeine between 12 and 4 can make a huge difference. We want to limit alcohol in these situations, limit ETOH, and the reason is that we know it's highly disturbing of your sleep. So we know alcohol is a sedative, but it affects the quality of your sleep and density of your sleep. And what we're trying to do here is get as much sort of momentum in during the day as we can. So I'm starting to think, hey, I need to feel sleepy. I don't want to have that caffeine in my system, so then I have to hit the brakes with some alcohol to self-medicate, to self-soothe, so that I can feel like I need to go to sleep. So again, setting up a routine of taking a warm bath, doing some soft tissue work, reading in a dim room, getting off your phones, having cough less, you've accumulated enough exercise activity, and all of the sudden, we see that this makes a big difference. Lastly, I want to point out that if you went to bed 30 minutes earlier a night, just got into bed 30 minutes earlier a night, it turns out in 2 weeks, you've slept a whole nother night. Think about what that means. The possibility of getting so much more sleep in. And once a month, that's 2 extra nights of sleep, two plus nights of sleep. And our goal here is to do is, what does Pavel say? Do is lift as heavy as you can, as often as you can, as fresh as you can. Whoever can do the most work and be the freshest wins. Well, it turns out this sleep is a non-negotiable. And what we're finding out more and more, of course, is that our brains see lack of sleep as another stressor. So as I'm trying to simplify the system, get to the bottom of understanding ways where I can shift loci of control and have some agency around managing these things, sleep is the game. Hopefully that helps.